lot of these factories move to China, they send their equipment over, or they sell it off. Like the equipment to make the stuff is not in America anymore.
You know who was right about this all along?
Kissinger?
No, the leftists who were protesting getting China to join the World Trade Organization, and the ones who were like, protect the American worker, don't let China join the WTO. And that was the beginning of the end for American manufacturing and American wages.
You still have people like Bernie Sanders, right? Elizabeth Warren, even Chuck Schumer. They're protectionist on this one issue, but I don't know if they're actually doing anything about it besides
commissioning studies.
Or it's a good soundbite, right? Like it's a good. You can talk is cheap, but actually bringing manufacturing back is going to be a hard struggle, and you might have to strong arm some companies, or get other ways to incentivize them, like what Japan was doing.
Speaking of talk being cheap, this episode is dedicated to all of the frontline heroes and their great sacrifices that they have made in the name of American corporate greed.
It's interesting also when he was talking about the people still reusing N95s. Most Americans are using cloth masks, which are not that effective. And compared to surgical masks or N95s or whatever. But, that was one of those things where the messaging from, the government was cloth masks because we didn't have enough surgical masks for healthcare workers. And now there's a glut of masks, but, people kind of just got used to wearing cloth masks.
Well, this is a danger that happens where temporary emergency measures become permanent. And I think that all of us have to be really vigilant that things that, we did or that we agreed to temporarily under emergency circumstances over the last year and a half don't become like a permanent long-term thing, unless they're good. I mean, there are some good things that can come out of it, but do we really want to give, for example, to agree to letting governments impose Chinese-style restrictions during, because it's an emergency?
Victoria in Australia just went on another lockdown.
That's Victoria, Australia is a whole other episode, and that's the state that has Melbourne. And their premier, Daniel Andrews, is basically, he was the guy who, against the wishes of the Australian federal government, signed a Belt and Road deal with China. And he's also the guy, he's a premier, not a governor, but he's essentially the most lockdown happy governor of any place in the free world. For a tiny number of cases, they've put on unbelievable restrictions. And I'm only saying there's a correlation between that and his China deals, not necessarily causation, but it's a scary thing.
I mean, it's just because they're trying to go for eradication, right? But then how can you do that if you are in essentially the only countries that were able to go that route were initially island countries?
Right.
And then now even a lot of them are having trouble.
Yeah.
So it just the idea of being able to eradicate it in just one state in Australia and locking down every time until you do, you're never going to be able to open back up.
It doesn't make a whole lot of scientific sense, but...
Well, Matt's point was about, emergency powers becoming permanent. And, Star Wars prequels, they really taught us a lot. Chancellor Palpatine, he got emergency
democracy.
And he got emergency temporary powers because there was a war.
One thing the U.S. government could definitely do is to revoke some of those emergency use authorizations that, like the one that Mike was talking about, that allows, hospitals to tell their staff to just reuse masks over
but
and over
now,
again.
Since money is involved, I bet there'd be a huge protest from people in the hospitals who are the ones making the money. I don't think we'd hear much from the healthcare workers themselves, but there's now people incentivized to fight something like that.
Yeah, I mean,
Yeah.
this is just one sign of how the entire healthcare system is broken when costs are disconnected from the people who pay them, which are disconnected from the people who need the healthcare or the people who give the healthcare. Like everything's so disconnected in that world that it's just like an insane knot of things that cannot be untangled.
I will say the FDA did just revoke their emergency use authorization for a lot of these N95 substitutes from China and other countries.
The KN95.
Yeah, so they're not, I mean, they can still sell them in the US to consumers, but they won't be allowed to be used as a medical grade product used in hospitals.
But
or
what they
whatever.
could do is change one letter in the URL for Prestige Ameritech
gosh,
and
that-
sell them.
That was crazy. But when what Mike was talking about with, and this goes back to your point about the healthcare system, the fact that all of these all these hospitals basically are in giant group buying co-op things where, you know, hospital systems are already huge, and then the hospital systems all band together to buy things together. You say you did have the administrator of one hospital who wanted to buy American-made masks. Would he be able to do it?
Yeah. The solution really is we need to decouple the U.S. and China economy.
On our terms.
Yes.
Yeah.
Because eventually China will do that on their terms.
Yeah, and we already talked about on the previous episode about how they're already starting to
Trying to do that.
And yeah, it's I mean, once they can successfully do that, it's a sign that we've already it's gone too far.
Yep.
But yeah, I don't know. I mean, it's not going to be an easy thing to bring manufacturing back to the US. It's going to be painful, but if we don't do it now before an emergency, it's only going to get more painful when we have to.
And we're Americans. We can take the pain now. We can make the sacrifice. We can do it.
As Winston Churchill said, Americans will always do the right thing after exhausting every other option. And with that, thanks for watching this episode of China Unscripted. We are assembled in America, manufactured in China. Once again, I'm Chris Chappell.
I'm Shelley Zhang.
And I'm Matt Ganesta.
Talk to you next time.